When you have too much cholesterol in the body, the problem with that is that it gets laid down into our coronary arteries and eventually creates plaques in the arteries. And why that's dangerous is because over time those plaques build up and cause narrowing in the arteries and prevent the blood flow to the heart. And ultimately that's what causes a heart attack, are those plaques and that cholesterol or atherosclerosis that builds up and hardens our coronary arteries.
I'm Diane, and I have coronary artery disease. I've had a heart attack, and now I'm trying to take care of my health and prevent another one.
Cholesterol is made up of different components, and one of the components is LDL, or the low-density lipoproteins. And another form of cholesterol is the high-density lipoproteins, also known as HDL. And another form of cholesterol is known as triglycerides. And all of that makes up the different types of cholesterol that we measure in the bloodstream, that float around in our bloodstream. Every young adult actually needs to know what their cholesterol is, and we recommend that women at the age of 20 get their cholesterol checked to know their baseline. And after that, probably get it checked every 5 years thereafter. Now, once you get to above the age of 55, you need to be checking it more often. And certainly if you already have coronary disease, you need to get it checked much more often. And if you're on medications for high cholesterol, again, it will be checked more frequently than that. Now, the worst type of sign or symptom that you can have is when you're actually having a heart attack or experiencing angina. That might be, unfortunately, a woman's first sign that their cholesterol is too high.
I had been to my doctor. My numbers were a little high, but they weren't at all off the charts. In spite of the tremendous family history of heart disease, I somehow didn't think that I was at high risk for heart disease. And so if my cholesterol was a little high and if my weight was over, but not hugely, I'm not as heavy as a lot of people, I thought it wasn't a big deal.
Well, there's usually two reasons why your cholesterol will be elevated. It's either genetics or lifestyle or both. We can't change your genetics. All we can do is address lifestyle. And when we talk about lifestyle, we really have many different components of that. A big part of changing someone's cholesterol will always involve changing their lifestyle, whether that's changing parts of their diet, whether it's changing whether they exercise or not, and how often they exercise, watching and discussing their body fat, which is always difficult but is necessary, and helping them quit smoking has to be part of the treatment.
I made some decisions when I was in the hospital. Our kitchen is set up for healthy eating. There's always a big bowl of fruit. There's always wonderful ingredients for salads. We have different kinds of lettuce. We have lots and lots of different vegetables. I am a very social person, and I see 4 different friends with whom I exercise every week, one of whom I met through my Women's Heart support group, and going there every week is just a huge help to me. My family has been supportive, especially my husband.
People with high cholesterol, first line of drug will always be a statin. It's the drug that's been proven to save lives and reduce the risk of heart attacks.
I have familial hypercholesterolemia. It's genetic high cholesterol in layman's terms. I only found out I had it when I was 52. I am 56. I've had it all my life.
For people who have FH, they usually come from a family history where there's a lot of early heart disease, or what we call premature coronary artery disease. They usually run a risk of having high cholesterol at very young ages, meaning in their childhood, and often can die from heart disease even in their early 30s. And those are people that hopefully are getting screened for their cholesterol also at younger ages and being told that they have this defect.
And so I met the lipid specialist, and he told me for the first time ever in my life that I had a genetic high cholesterol issue. That was such a life changer. Just to find that out, I ate right and I exercised. I did everything I thought I could possibly do. It was very frustrating, and it was, for me, I don't know, I felt guilty. So when I got the diagnosis for FH, and that it was genetic, it wasn't my fault, it's like I got my life back. Looking back on it now, had I known when I was younger, we could have treated me a lot more aggressively, and the things that have happened to me along the way didn't need to happen.
I think that's what's really important for FH patients to know, is that if their lipids aren't getting under good control, there is emerging therapies now, some that we're just studying, but some that are actually on the market now for us to treat their lipids. And I think that if they aren't aware of that, it's an important conversation for these patients to have with their physician or with their lipid specialist.
Well, I'd say if you have consistently high cholesterol, get checked. Number one, get checked. Know who you are, know your body, know the facts, and take the advocacy to your doctor's office.
The ideal patient partnership with me would be somebody who's willing to accept not just medical therapy as part of their treatment, but also lifestyle changes.
Sometimes heart disease can rob you of your identity. It doesn't have to be that way. You can still be your own self and do the things that are important to you.
You know, I am so grateful that there are many things that are really easy for me now. We eat differently, and I enjoy food more now than I did before I had my heart attack. I want to live. I want to be there for my kids and my grandkids.